Thank you very much, Mr. Moderator. Ladies and gentlemen, let me initially thanks very much Dr. Vinod Shingal for this nice invitation here in Dubai, and let me wish all my best compliment for the opening of this hospital here in Dubai, the Prime Hospital, that I'm sure it will make a significant point of reference for many surgeons, many doctors and patients here in this area. The topic I'm going to address this morning is very general, but is very interesting for all of us working in the field of bariatric surgery, because it refers to the number and type of operation performed for metabolic and bariatric surgery throughout the world. Professor Scopinaro, that was the founding member and president, first president of the International Federation for Surgery of Obesity, this big federation which put together all the national society, in his presidential address was the first to consider the hypothesis, the ambitious hypothesis of recording the operation performed for this topic, for this disease around the world. And after him, Backwald and myself have been trying to pursue this aim of collecting the operation. Now, the 2013 collection of worldwide statistics, that was also the one when I have been president of the IFSO Federation, was the largest number of bariatric operation ever collected in the world. What we did was to create a simple form with few topics, because of course, if you ask many information on patient, it might be very difficult to receive the answer, while the question were very general, the type of operation and the number of operation. At that time, we are also been considering the approach, if it was laparoscopically or laparotomically, as you can see by these slides. Almost the majority, 96%, were performed by laparoscopy. And the very good thing is that this simple form was answered by 90% of the national society participating to IFSO. So what we know now is that there are countries in the world that have a national registry. In this area, for example, in Middle East, we know very well that the Gulf Society has a quite accurate record of operation, while, for example, in January I was in Kuwait, where we don't know anything about the operation. They don't know anything about the operation. So the idea of this collection and this study is also to stimulate single national society that have no idea of the number of and type of operation performed. We talk many often of quality, center of excellence, but we should start from the very basic. There are countries in the world where we don't know how many operations are performed. There are, of course, society with the national registry which recognize that their number were not complete, and this is apply very much to the society to the nation where you have public and private program. So often the private program are not included in the national registry. And of course, as I was mentioning, there are society with any data. So we know now, and I didn't know before, that Israel is the place that has the highest number of bariatric operation per population in the world. So Israel, Belgium, Sweden, this is the world statistics. with America, USA, and Canada at the end of this series, although they do the highest number, but if you consider the number per million of population, is not so high. In Middle East, as you see, Saudi Arabia is the country where you have the highest incidence. And this is the total number of operations divided by the 4 more commonest performed operation. So as you can see, always Roux-en-Y is the most performed operation, followed by sleeve gastrectomy, band, and BPD. During this presentation, I will give you more details regarding other operations performed. When you see the trend in percentage, you see very clearly that there is a logarithmic increasing trend for sleeve gastrectomy, while there is a sharp decrease of adjustable gastric banding. And here you see this in these slides. This is quite new. The paper is going to be published in the next few months in obesity surgery. That beyond the typical operation performed, the Roux-en-Y, sleeve, banding, and BPD, I have included here gastric application, of which we have Professor Martin Fried here. He's one of the pioneers of this operation in Europe, that is still in a limited number of operations. And we have the mini gastric bypass, because many surgeons are talking of mini gastric bypass, and is considered by some a new coming operation, although you see still is in the phase of 8,700 operations, so limited number, while there is still a very limited number of vertical banded gastroplasty that I think are going to disappear in our next report. These are the number divided in a different way for different chapter, and as you see, the Roux-en-Y remain the commonest operation only in Latin America, because in Europe, Europe is almost equal to Roux-en-Y, but North America and in Latin America, you have the most are sleeve gastrectomy. So this is the number of operation and the trend percentage in United States, Canada. As you know, IFSO is divided by 4 chapters. This is the American, the so-called American chapter. You can see how sleeve gastrectomy increased of plus 244%. So it's a sharp increase. Here you see the trend. When you see the trend, you see that sleeve gastrectomy has overcome Roux-en-Y gastric bypass, and this is really a very important data for the worldwide consideration of sleeve gastrectomy. When we go in Europe everything is more balanced, is more calmed down, and is soft. We do not have a very much increase. Sleeve gastrectomy had a modest increase, but not great. But in general, the increasing trend was not so favorable as in the other chapter around the world, perhaps because of the economical crisis. You see that sleeve gastrectomy is now exactly the same as Roux-en-Y. And the other thing is that although adjustable gastric banding is coming down, we still perform in Europe quite a large number of banding. This is the Latin American chapter. Mainly Brazilian surgeons are the most contributing area, and you see that Roux-en-Y is still the preferred operation in Latin America. And you see how sharp is the difference between Roux-en-Y and sleeve gastrectomy in Latin America. It's, I think, the only country now where Roux-en-Y still had an increasing trend of performance. If you see here, Roux-en-Y has a sharp increase in comparison to the other operation. When we go to Asia Pacific, so we come to close to this part of the world, because technically Middle East is part of the Asia Pacific chapter. You see that in Asia Pacific, sleeve gastrectomy is by far the most common operation performed. So in conclusion, there has been a constant increase in operation for bariatric and metabolic around the world. And although there is a decrease, still Roux-en-Y represents the most common operation now. There has been a step decrease of adjustable gastric banding. And in two chapters, in America and Asia Pacific, Roux-en-Y has been overtaken by sleeve gastrectomy that has become the most frequently performed procedure. And now, of course, there might be many explanations why sleeve gastrectomy is the preferred operation in most of the countries around the world, perhaps on the weight loss outcome, the feasibility and the simplicity of performance, the result of sleeve gastrectomy on comorbidity. We don't know as yet. What we know in Naples is that after more than 20 years of operation, I have organized the first in Naples a live surgery course in 3D to show to a limited number, to share with a limited number of participants my approach to revision operation. These days, after 20 years, I start to do more revision than primary operation. So basically, we have still a lot of work to do to decide which is the best operation for us to do. Thank you very much for your attention.
Thank you, Professor Angrisani. We have questions. Yes, please. Please wait till you get the microphone so we can hear you.
Half of 2013 patients around the world. Do you think is related to the financial crisis, or
no?
What was the reason? It's a huge difference.
No, 2012, the thing was that this is based on a report we received in the executive secretary of IFSO that is based in Naples, from data collected from president and executive board of national society all over the world. What happened was that at that time only 50% of the national society have been participating to the study. So in fact, we have not considered that data in the analysis because it was too little, the participation of the national society. But if you the story of this data collection is that Scopinaro and Buchwald have done this quite anecdotically, based on their personal friendship and knowledge of the president and the people working all over the world. I tried to change a little bit the infrastructure of this study, creating a system which would allow us to know every year which is the trend, because I think that this is very important. It's very important for me to know that in Europe now, bypass and sleeve are performed, are chosen by surgeons equally, while in Asia Pacific and North America, sleeve gastrectomy is by far the most preferred operation for those people, for those surgeons working in that area. So in 2012, it was only a question of data collection, because we have a very lack of participation of the national society.
historically, when did bariatric surgery start? How long can you look back at all?
How?
How long, time-wise? You're reporting about the last 15 years, but I would like to know, how old is bariatric surgery? How long can we trace it back at all?
I think it goes back to the early 70s. But Scopinaro is not here. He will tell you. I was not there at the beginning, but perhaps no. I think all the people in this audience,
Yes.
Martin and Charlie.
There was
perhaps.
Dr. Miller coming.
Charlie has. Jejunal bypass, perhaps.
Not really. That was the second
The
procedure.
second.
The first one was in 1956, done by Edward Mason. I had the privilege to organize with him an international conference in 2003. He started with gastric bypass surgery. Initially, he found out that
1956 was gastric bypass?
56 gastric bypass. After that, the jejunal bypass, they came 15 years later. And then Edward Mason invented also the VBG, the vertical banded gastroplasty, to avoid complications from gastric bypass surgery. So the idea was the gastric bypass patients for carcinoma never gained weight. So finding by that idea that a bypass patient who had a surgery because of cancer never gained weight, he started doing bypass surgeries in obese patients. That was the beginning of bariatric surgery. So sorry to interrupt.
Thank you very much, Charlie. It was very helpful.
Yeah, I'm a dinosaur in that phase. I'm doing 21 years now.
Okay, thank you very much.
Thank you.